Healthcare has been a big discussion across Canada this week. And the reason for that mostly has been because Pierre Poilievre and the Conservative Party have brought forward a motion in the House of Commons to try to stem the use of the supplemental care program in Canada by people who have been refused refugee status and might, for whatever reason, they're still here. Even though they've been refused refugee status, they still have the right to appeal that decision. And so while they appeal it, they stay here in the country, which means they're able to access the healthcare system. Now, the Conservatives, let me be clear on this, the Conservatives are not talking about emergency services for people. They're not talking about people being able to go to an emergency room and get service or see their physician and get service. That's not what this is. This is the supplemental program. This is things like prescriptions, eyeglasses, prosthetics, medical aid equipment like walkers, bedside toilets, things like this, things that make it easier for people who have an illness or an injury to be able to live their everyday life. It's long-term nursing care. It's nursing care in their home. It's things like this that they want the elimination of coverage for. This is projected to cost Canadians $1 billion this year. $1 billion just for this supplemental care program to people who have been refused refugee status in Canada. $1 billion. A lot of us can't even fathom how much money that is. But that would pay an awful lot of physicians and an awful lot of nurses to take some of the backlog out of our ERs. It would reduce wait times. It would give us better medical equipment. It would make life easier for some of the people that are trying to provide care throughout our country to have these extra dollars in their budgets to work with. I don't think it's an unfair ask that people who've been refused refugee status not be able to access free care to these programs. A lot of people in Canada don't get free care to these programs now. These are things that, unless you have medical insurance through your place of work, or you purchase the supplemental medical insurance through a private insurance company, you probably wouldn't have access to it for free either. Canadians, even Canadians who have paid into the system their entire lives, paid their taxes, paid their dues, might be waiting for nursing home care but can't afford it, these people are not covered for it unless they have some kind of supplemental insurance. There's a lot of people that are admitted to nursing homes that have to pay out of pocket for that care, or at least pay a copay toward it. So we have people in our country that have been refused refugee status, but they still get these supplemental care benefits. That seems really unfair to me. And I don't begrudge anybody health care in this country. As someone who worked in healthcare, I know that emergencies happen, people get sick, things happen to people, and they need help. And that's not the kind of care that we're talking about with this program that the Conservatives are trying to eliminate. People will still get emergency care. People will still get seen by a doctor. No question. That's never been a question in Canada. People get care. Doesn't matter what their status is. Nobody asks that when you go into an emergency room. People get care. We save lives in Canada. Our doctors and nurses and paramedics and lab techs and x-ray techs, all the people that work in healthcare, none of them would ever deny anybody emergency care when somebody needs it, regardless of their status in this country. Nobody even looks at that. What's important is helping people, and that's what our healthcare providers do. But it's really hard to provide proper healthcare when you have so many people who have been just flooded into our system over the last number of years. And they can say that they have reduced a lot of these people by half or a third. But when you've had such an overwhelming number of people taken in, that even eliminating them by half or a third, it's just not enough. It's not enough to make a difference. It's not enough to open up the wait times that we have for so many people across this country. Canada does have a really good healthcare system. When it really counts in an emergency, we have a good system. People here save lives every day. There's no question. But we do have an issue with backlogs. We have an issue when people are waiting for months to get appointments for things like CAT scans or MRIs. We have an issue when people are waiting months for ultrasounds, when they're waiting a year or more to see a specialist. People like waiting for appointments with neurologists. Sometimes those wait lists can be upwards of 2 years for neurology. Not necessarily urgent people who need to see a neurologist right away, like people who maybe have suffered a stroke. They don't necessarily wait that long, but somebody whose doctor thinks that maybe they might have Parkinson's may have a year or two to wait to see a neurologist. That year or two, while waiting, can be a huge difference in someone's long-term outcome with a disease. That matters. That matters to a lot of people. And so the problem is the strain that our healthcare system is under. When it comes to the wait lists and people waiting for certain things, it's far too long. It was never built to work this way, and it's certainly not the way that it was years ago. We started to see the decline in healthcare, I would say about 20 or 25 years ago, when we noticed that we would have an ER closure in a community where an emergency room would close for a night, which seemed mind-blowing at the time. And then a night turned into 2 nights, and then 2 nights turned into 4 nights. And then that just slowly turned into, well, this ER is now closed altogether, to now these 2 ERs are now closed altogether. And in a lot of cases, we did have a lot of repetition of services that needed to be dwindled down and eliminated due to cost. But in a lot of cases, some of those smaller emergency rooms took the strain off the bigger emergency room and the more regional facilities that we had in our areas. And so now what we have is the regional emergency rooms are open 24/7. We do have some smaller outlying urgent care treatment places and maybe the odd ER open for day shifts or whatever. But we still have a huge backlog where it takes hours to get into an emergency room. We have people waiting on ambulance stretchers who can't get offloaded in emergency rooms, that wait in hallways for hours at a time. Even though they're triaged at a high acuity, they still wait and wait for offloading because they just don't have anywhere to put these people. They have nowhere to treat them. And so it becomes this vicious circle, and we need to do something about that. So I think that the motion that the Conservatives put forward this week is a good first step. Because if we're spending $1 billion a year on this program, that's $1 billion a year that we don't have to spend in other areas that could really use it. We need more long-term nursing facilities. We need more care in homes. We need to keep people home as long as we can and have nursing care come to them. But the problem is that we just don't have the budgets to be able to do it. To have another $1 million injected into those budgets would be a huge difference to the overall outcomes that people face with healthcare in our country. So I don't think it's being racist or mean or trying to take away from people who deserve care. People are still going to get emergency care. It's just that a lot of us question whether people should get this supplemental care that even most Canadians don't qualify for. At the end of the day, there's only so many dollars to go around, and we have to spend those dollars wisely. That's all we're saying. So if we sink $1 billion into supplemental care for people who have never paid into that program ever, then is that really fair to the people that have worked hard their whole life and now can't access those things? We need to ask ourselves those questions. So this isn't a post to dog on refugees or people that have come to this country for one reason or another. It's a post to bring some realization to the fact that we're not talking about emergency care. People are still going to get emergency care. People are still going to get life-saving care. That's not what this is. So when liberals sprout off and say that Conservatives want to take critical care away from people, that's not what they're saying. That's not what this is. You have to realize the difference between critical care and care that's not critical. Have a great day. Best of health to you all. Take care.